Hello viewers, today we will be discussing about non-obstructive azoospermia, which is the other form of azoospermia, where azoospermia means zero sperm count. I think previous videos we discussed about the types of azoospermia. One is obstructive azoospermia, second one is non-obstructive azoospermia. So, non-obstructive azoospermia means the testis stops producing sperms, or only in some areas of the testis there is production. So, there are various reasons for this. Some kinds of steroid intake, some infections in the childhood, some testicular infections which has damaged the testis. Sometimes it is a genetic cause where production, the testicular growth itself is not good, and many people with non-obstructive azoospermia will have small testis. So, sometimes this is because of when their parents are parents marriage is of consanguineous marriage, then also it can lead to small testicular growth, and which can lead to non-obstructive azoospermia. So, now how do we manage non-obstructive azoospermia? So, in non-obstructive azoospermia, what we do is we do couple of hormone tests. Generally, we do FSH, LH, prolactin, testosterone and estradiol, and sometimes we do hormones like inhibin B and scrotal Doppler, and sometimes we do genetic testing like genetic test like Y chromosome microdeletions and karyotyping. This will tell us what is going to happen what is happening in the testis, whether it is a genetic cause or non-genetic cause. Sometimes these tests are inconclusive. They may not tell us whether there is a sperm inside the testis or not. So, in that scenario, generally what we do is we do a procedure called TISA. TISA means with the help of a needle, small needle, under local anesthesia, we will collect small fragments of testicular tissue and we have to send it to the lab, and we have to analyze the testicular tissue. So, what do you get from this analysis? You will know whether there is production in the production of sperm in the testis or not. Second one, if production is there, why it is not coming out? If production is not there, then why it is not there? If production is not there, can we do something to get some sperms so that we can do IVF? If production is there, the quality is good enough for us to go ahead with IVF, and if production is not there, what is the other thing what we can do? Is there any option, or at least can we proceed with micro-TSA to get sperms? See, all these we get answers for all these things. See, now whenever any doctor, whenever we see a patient with non-obstructive azoospermia, nobody can predict whether there can be a sperm inside the testis or not. Sometimes we correlate with the FSH value. Sometimes we say when FSH value is too high, there is very less chance of getting sperm. Sometimes when testosterone is too low, generally we try to increase testosterone by giving some hormonal injections and hormonal medications, so that if at all there is any immature sperm inside the testis, we make it mature before taking it out. Sometimes just giving hormones itself, some sperms will come out, then we have to freeze those sperms and we can do IVF procedure. But what are all the surgical options what we have for non-obstructive azoospermia is, one is TISA. If there is no sperm in TISA, then generally we do micro-TSA procedure. Micro-TSA is like a surgery where we have to cut open the testis. We have to do this surgery with high power microscopy, and we have to actually search for the healthy tissue inside the testis, and the yield of the chance of sperm retrieval is very good with micro-TSA procedure. TISA is like random sampling testis. Micro-TSA is actual searching for the testis in each and every corner of the testis. And sometimes if a patient is having severe varicocele and small testis are cross varicocele, sometimes we do not do TISA, we do varicocele surgery first. If it is only severe varicocele, not grade 1 varicocele, then we have to wait for 2 to 3 months. If there are some sperms in the ejaculate, then we can freeze them and do IVF. If there are no sperms, then that is the time we have to do TSAR micro-TSA. So, these are the treatment options for available for non-obstructive azoospermia. If you have any doubts regarding non-obstructive azoospermia, please post it in comment section. We will try to make videos on that particular topic. Thanks for watching.